University of Maia and holds a PhD in Physical Activity and Health from the Faculty of Sport of the University of Porto. She gained experience in epidemiological research as a research fellow at the National Institute on Aging in USA. And the other speaker is Paulo Nicola, who is a physician and an epidemiologist at the Epidemiology Unit of the Institute of Preventive Medicine and Public Health of Lisbon University Faculty of Medicine. Currently, he also assumes different academic responsibilities, including teaching and mentoring undergraduate and graduate students. Paulo Nicola obtained experience in clinical research and epidemiology at Mayo Clinic in the USA and was an advisor to the Deputy Secretary of State of the Portuguese Minister of Health between 2011 and 2015.
Okay, so thank you for introducing us. Hello, everyone. So I will start, and as a member of the team leading this project, I'm very happy for having this opportunity to share with you our thoughts about what we think we can do to scale up best practices in diabetes in Portugal. So we have been talking about best practice, and I'm just going to do a quick review of what does it mean best practice in healthcare. And by health practice here, we mean health promotion, we mean diabetes prevention and management, and the Diabetes em Movimento is a good example of one of these best practices. There are many other expressions that can mean something very similar to best. So we can be talking about, or we can read something that is saying that is a good practice, is a promising or an innovative one. So this definition of best practice goes well beyond the quality issues. And also when we see the expression practice, it means it can mean many things. So an intervention like Diabetes em Movimento, but also a policy, an activity, an approach, an action. There's many words that fit, or many things can fit what a practice means. And I'm also sharing with you the definition that we are using for best practice. So best practice is something that is relevant, policy intervention, as I said before, in real life, in a real life setting, as Romeu was giving the example, and which has been favorable assessed in terms of adequacy, equity, effectiveness, and efficiency. And we just heard the presentations before talking about these topics, and also there to be a successful transferability, it requires a clear definition of the context, the sustainability, the intersectoriality, and the participation of stakeholders. There's also many reasons why we should be talking and trying to identify and transfer best practices. We just put here 3 examples. So it's an important approach to the preventing and managing diabetes. And we just heard a good example. It's also a mean to support the achievement of the WHO and UN targets for non-communicable diseases. And by identifying and transfer practices that were already evaluated, we are also avoiding the need to go through a lengthy trial and error phases. So it's much faster, the implementation. But we also believe that a best practice is a source of governance in health. But we need to maximize dissemination as a tool for governance, and we need to maximize the impact of a best practice. So from a governance perspective, we need to increase the funding opportunities and other incentives to promote the best practices. We need to increase the research about the good practices. We may use good practice as a tool for training and professional development. And another way of maximizing the dissemination is using like a best practice platform. That if you go through the work in CHRODIS, you will see that they work on the development of a platform, a portal. And in this portal, we can use it as to create a database of well-described interventions that can be feasible and implemented in our context in Portugal. So this is some aspects when we are looking to best practice from a governance perspective. And now I'm going, so I was just giving you here introduction to our topic, and now I'm going to stop my presentation, and Paulo Nicola will follow, sharing also the our intentions to do during this project, the DUA initiative.
Thank you, Elisa. So it was very inspiring to hear the previous talks, and I'm just between our open discussion, which will be very important, and getting all your thoughts and experience. And for this, what we thought is to end up with detailing a bit of our plans to implement a research project that can promote best practices in diabetes. So I'll go through quickly through the steps of this project. These are the key aspects or the key steps of this project. First, defining and reaching potential participants, and we'll define what is a participant and how we screen practices of interest. So before qualifying as a best practice, what can have interest to be evaluated and characterized by this project. And then the data collection analysis that we'll be doing, and how this mixes with the future perspectives. So why can this project be useful? So the first part is what is the target participants that we are targeting? Well, we are targeting anyone, which can be an individual, a team, an organization, a partnership, a network, who has developed or added specific, innovative or tailored responses, interventions, policies, process, products, which are explicitly aiming to improve the health or practice of prevention, well-being, literacy, access, involvement, or individuals with diabetes or caregivers, and which may be of interest to be disseminated, known, evaluated, or studied. So this is to show how we consider that we should have a very broad definition of practices or a broad definition of what can be understood as an innovation or a practice of interest. And for this, this is a very critical aspect of this study. It's very important that we launch this radar, this network, to be able to identify these practices, making the most use of the health system. So we'll need at the hospital level to contact directors, service directors, clinical directors, nurses, doctors who work with patients with diabetes, but also with associated aspects of these patients. So I'm also thinking about cardiovascular diseases and other diseases. Of course, primary care, we'll have to reach directors and coordinators of primary care units to ask them to screen what can be a practice of interest, including not only primary care as family practices, but also occupational medicine. The public health, which also developed not only national programs, but regional programs and local programs with at several levels regarding also diabetes. Pharmacies, the patients can be an extremely useful resource to identify good practice, so practice that matter to them. Scientific and professional societies, some have special study groups and support research and have activities and initiatives. Researchers, academic and non-academic. Then organizations, industry, health insurers, all others that can identify what we call at this level practice of potential interest. So this will be actually a very important aspect for us to be able to find what we can then have as a participant. We'll have a screening question that is also very broad. What practices or initiatives you directly or indirectly know which might be useful to know better, characterize, eventually study and disseminate, and who is the person or entity responsible or involved in this initiative for practice, who we may contact to know more. So this is a very broad screening question, and with this reaching out activity by email, by direct contact, by social media, by connecting with stakeholders, we want to identify contact authors and invite them for a process of data collection. So after this screening, which we'll have to identify potential redundancies and get contacts, then we'll have a phase of characterization of the practice of interest, and then understand what are the resources, the impacts, the tools that this practice makes use of, so we can follow up to a consensus process and a best practice collection or repository. So I'll go quickly through each one of these stages. We just had the first one. And so for the characterization, we'll ask with an online tool for participants, which are related with this practice of interest, to identify their area and to describe what this practice consists, what distinguishes itself from common practices, and what is the additional value or gains aimed with the practice. So these are open questions that will allow us a first description. And then some qualification for us to help the area to classify the practice and what is the relationship of the participant with the practice. For instance, it can be a patient that has experienced that practice of interest, or someone that participated on the monitor or evaluation or other situation. So with this first round of data collection, we'll have a first classification, a first description of the practices, but also a list of institutions, professionals, and entities that are participating, and some of we can then move on to have further detail, ask for testimonials, make interviews, so we can go deeper, or ask for documentation or studies, depending on how developed and how mature that practice is. A second stage will then move on, so we can better characterize the resources and impacts associated with the practice. And then, so we want to clarify the definition to understand the generability and potential reach of this practice, outcomes, and expected resources for implementation. And so this aspect on what are the expected impact on outcomes is very important for us to classify and give value to the practice. So these outcomes can be very variable. They can be health outcomes, of course, but also quality of life, well-being, better disease control, access to healthcare providers, participation on decision-making, support and removal of barriers. So several dimensions, and some of these are related with other aspects of the evaluation of care in diabetes. And this is, for instance, what I shown defines as the value of diabetes care, the dimensions associated with creating value for diabetes care, and we make some parallel. We also want to understand the impact at a short term and the medium term. What is the expected impact or the experience on the impact? This is one aspect. The other aspect is the resources. And so what training was involved, was it needed, as aspect regarding with the management of the practice, dedicated human resource funding, information or articulation with existing information system, material and logistics, norms and regulations, partnership, collaborations, protocols, and others. So this practice, what it required for its implementation. This will be a second round of data collection, and which will follow up by a Delphi panel that will understand what is the agreement among key aspects of well-characterized practices. Our panel will understand what is the agreement panel regarding the proposed aim of the practice, outcomes, impact, resources, ability to be disseminated and reach. That is one aspect. The other aspect will be the collection of best practice, not only the classification of them, but also the records, the testimonials that we can produce, documents associated with the practice, so an organization, a repository that will to be available for everyone. So all this to lead to where? First, this is a part of the work regarding governance in diabetes and strengthening governance. That was the subject of our first seminar. And best practices are an excellent way to identify and to incorporate innovation, are not the only way, but they take advantage of real life diversity. And it's a bottom-up progress and contribution, which is multidisciplinary in nature, commonly multidisciplinary, and comes from a practical setting. So it indicates what can be done. And it also identifies expertise and leadership, which can foster change. And it's very important to relate resources with initiatives. This can be, we want to do this very specifically. So we can answer the question, what changes, what interventions can be achieved with what resources? And lastly, the availability of best practices also justifies an expectation for improvement. So if a primary care setting unit or a city is with bad indicators, it has needs for better access or better health outcomes, better health status, then there is a list of practices that can contribute to that. And so we make, this helps to make an expectation for goals and targets for health units and not only. Also, it sets the ground to improve research and evaluation on innovative practices. And our first presentation gave very clear criteria and dimensions which can also improve the way that best practices are not only characterized, but they are developed. That will provide recommendations for research agenda and for the processes to regularly evaluate, identify and evaluate practices, but also foster collaboration and network between professionals and stakeholders. And also rank initiatives which best answer needs and identify intelligent investments for the future. So what are the common barriers that we have to work at the national, regional level, international level, but also how we can have better policy strategy planning and resource allocation. So this is our final purposes, is to direct to these future perspectives. And now we are eager to have a discussion with you and to hear your thoughts.